So once they know already that my placenta is in lower side, their doctor would advise something to take care of that. Refrain from the intercourse. Don't do heavy work. Don't lift heavy. Don't do heavy work, and this avoid trauma to your abdomen. Suppose while you are driving, that this buckle yourself very well. So these are the conditions. If you are having blood pressure, high blood pressure, then do frequent routine antenatal checkup. बहुत बार बार आप अपने डॉक्टर के पास जाके दिखाएंगे, ताकि if blood pressure will cause any complication like placental insufficiency, or it's your bp will not is not controlled, then your doctor will advise something, or say, give some medication to for treatment of that. So इसलिए, और in day to day practice in your at your home, if you experience vaginal bleeding, any type of vaginal bleeding during pregnancy, alarming sign, you must consult your doctor. You have to go to the hospital. Or if the bleeding is associated with severe pain abdomen, or without bleeding also, if you are experiencing severe pain abdomen, you should go to the hospital or consult your respective doctor. Or you are feeling any headache, or this blurring of the vision, or any upper part of the abdomen, means pain in the abdomen, you have to go to the doctor. So these are
Yes.
some conditions that mother should be aware of, so that they can go timely to their doctor and just can be saved.
Yes. Thank you so much, Dr. Nisha, for explaining us this such a complicated topic, I would say, as well as it is very important for general public to know about it as well. So, Dr. Nisha, I will just take a few questions if it's there from our viewers' side. Doctor, one of our viewers is asking that before my pregnancy, I was suffering from low BP. So, can it lead to the placental complication? She is into her seventh month of pregnancy.
No, if before pregnancy, if blood pressure was low, then that will not hamper. If during pregnancy her blood pressure is all right, then that is okay. If it is going smoothly, or there is no any fluctuation, or no high bp or low bp, then I think no complication will be there.
Okay. Doctor, one of our viewers is asking that uh, can placental complication be seen through ultrasound? Uh,
Yes, definitely.
yes. So,
Definitely placenta. This complication, as I earlier said, that yes, ultrasound, we can diagnose by ultrasound. This low lying placenta can be diagnosed. If you are having abruptio placenta, we can see the retroplacental clots. The amount of the blood in between the placenta and the uterus can be seen. And this morbidly adherent placenta, one of the condition in which placenta grows deeply into the uterus. Usually, some of the our diagnosed by ultrasonography, but sometimes need MRI for that. MRI of the. So yes, by ultrasound we diagnose the complications.
so, ma'am, during in which month of pregnancy it can be identified very easily? Like if the placenta is attached to a wrong place or somewhere, so in which month it can be diagnosed?
Yes, if mother is doing routine antenatal checkup regularly, so usually we gynecologists do at 5 months one ultrasonography. Most of the low-lying placenta can be identified at that time. So we can mark that yes,
Okay.
this placenta is attached in the lower side. So that those mother will be advised few things, that you should not do heavy work. If any bleeding will happen, just contact immediately to the doctor or the hospital. Don't go for any intercourse. These are the precaution we will advise to them. If but in case of abruptio placentae, that is a sudden this onset. It will not give you clue in before that. But yes, if lady is having high blood pressure, there is chance that she might experience that abruptio placentae. So this abruptio placentae more frequently happens in the last trimester, and this is a good thing about that, ki it
Yes.
happens around last trimester. By till then baby will be matured, and we can save both mother and baby if timely intervene. But
Yes.
in case of low lying placenta, it's a recurrent sort of kind of. means you will experience little bit bleeding, again it will subside, again you will experience little bit bleeding, that will go on, and as the pregnancy progresses, it will the tendency of the bleeding will increase.
Okay.
So if you routine can be diagnosed earlier in case of placenta. Morbidly advent placenta can also be diagnosed earlier. Also, placenta deficiency also can also diagnose earlier. But in case of abruptio placentae, it was the this instant diagnosis. It happens, it can be diagnosed.
Okay, Dr. Nisha, these were the questions for now. Maybe later on, also, if the viewers have a look at the video, then if any of the questions come up, I will definitely send it to you. So, till then, Dr. Nisha, so what exactly what conclusion I would say, or what is your suggestion to the mothers who are going to deliver? So, what all suggestions you would like to give them?
Okay, since we cannot cure all these conditions, we cannot cure, but yes, we can definitely save mother and the baby if we can intervene earlier, or we can diagnose early all these things. So, just I am not saying that yes, you should be worried all the time that I am going to have placental complication. I am not saying that, but yes, keep vigilance on yourself, monitor your BP, do your regular and follow the advice of your doctor, and do antenatal ultrasonography so that we can diagnose all the situation as early as we can, and we can timely intervene into them so that this morbidity and mortality to the mother and the baby both can be decreased.
Definitely, Dr. Nisha. So, thank you so much, Doctor, for your valuable suggestions as well as your expert guidance on the placental complications during pregnancy. And we thank to you from bottom of our heart from Human Biologicals Institute team, as well as from all our viewers as well. And
Thank you.
thank you,
Thank you.
ma'am.
Okay.
And
Thank
once
you for.
again,
Mhm. Yes,
yes,
yes.
Doctor, please.
No, just hope. Am I clear to all the viewers? I don't know what uh, they will learn from us. From
Definitely, Dr. Nisha. It was very simple, I would say, and a kind of clear explanation in Hindi as well, wherever you were finding it difficult to, that people might not be able to understand in English those medical terminologies. तो वो आपने हिंदी में भी बहुत आसानी से एक्सप्लेन किया मैम थैंक यू सो मच फॉर दैट so now it's time to say goodbye. And once again, on behalf of Puberty to Menopause, a women health awareness initiative by Human Biologicals Institute, I wholeheartedly thank to all our viewers as well. We request all of you to visit www.pubertytomenopause.com for more information on various health aspects of women at different stages of life. And also, you can follow us on Facebook, Twitter, Insta to get more updates on health and live talks with expert doctors across the nation. So till then, choose better health as well as happiness for yourself. See you all again in yet another interesting topic of women's health. Till then, bye and take care. Thank you so much, doctor.